بسم الله الرحمن الرحيم. ألف شكر أستاذ دكتور مرسي. Dr. Morsi had been the godfather, and he is the godfather. He will continue being the godfather of the region, and for all of us working in the field of diabetes. I'm very grateful to you, and we are proud that we were and continue to be your students in the field. The diabetes burden in Egypt. Just we are. I'm time conscious. We are late 20 or 25 minutes, so we have to avoid any further delay. So diabetes burden in Egypt. This is the last edition of the Diabetes Atlas. It's 1 year ago now. So anybody who had not downloaded that Atlas, I advise that please go and open the Google and just download it. You'll find very beneficial information about diabetes throughout the whole world. Discussion of diabetes in a certain community will never be completed if it is not involving the NCD background of diabetes. The NCD, non-communicable disease. I think we are repeating the term NCD all the time, so it's familiar for us now. But the NCD background is very important because the risk factors are common between diabetes and other members of the NCDs, and because of the interrelation of the NCDs to each other, both in incidence, both in progression to morbidity and mortality, and in the cost as well. So NCDs are integrative with each other. We can split them from each other, and we have to look them at that sort of holistic approach and holistic vision to the issue of the NCDs and diabetes, of course, right in the center of these diseases. These are the common risk factors of the NCDs and diabetes. Tobacco smoking are on the top and should continue to be on the top. We have to continue acting against smoking, unhealthy food, sedentary life, and between brackets, harmful use of alcohol. It's use of alcohol, but because recent figures, recent studies are coming indicating that any use of alcohol is harmful, but in the Western world, they cannot say use of alcohol. So it's a sort of hypocrisy, I have to say, but it's the harmful use. This is a term used by the Western company where we get the terminology from. The NCD interrelationship in diabetes, for example, we know that it's a bidirectional sort of effect to be affected with. So diabetes and other NCDs are bidirectionally related to each other. Cardiovascular disease, hypertension, heart failure, ischemic heart disease are affected by the presence of diabetes, and they increase in the meantime the incidence and prevalence of diabetes among this population. Obesity is the interface between the risk factors of the NCDs and development and occurrence of the individual members of the NCDs. Cancer is affected by diabetes in both directions as well. Cancer increases the incidence of diabetes, and diabetes increases the incidence of cancer. Obstructive sleep apnea is a very important relationship between diabetes and obesity and chronic chest diseases. And mental health, it's the container, it's the great container which everything is put in, and you can imagine through that the integration between diabetes and other non-communicable diseases. Having said that, I have to say that non-communicable disease, including cardiovascular disease, diabetes, cancer, and chronic respiratory diseases, these are the main 4 diseases between the NCDs. They are currently the leading national cause of death in Egypt. And NCDs are estimated to account for 82% of the total mortality in our country, while they form 71% the global figure. So that will give you an impression about the seriousness, the burden of the NCDs in our country, and the NCDs are accounting for the 2/3 of the premature deaths in Egypt. The stepwise survey is a survey designed by the WHO just to make a sort of survey regarding different risk factors and incidence of different NCDs. And they used to do it every number of years in different countries. So it's a good tool to compare the prevalence and problems or burden of different NCDs. This is the result of the stepwise survey conducted by the Ministry of Health in collaboration with the WHO. Revealed a significant high prevalence of the risk factors of NCDs in Egypt, 24% prevalence of smoking, and a growing use of shisha tobacco, especially among women. One of the most overweight populations in the world, with 66%, especially among women again, 66% are overweight and 42% with frank obesity. Almost 3/4, 75% of the population not involved in brisk activity, which is required, and 17% prevalence of diabetes, 40% prevalence of hypertension. Egyptians have an average daily salt intake of 9 grams. This is double the daily allowance internationally. So have everything actually, preparing our community to have diabetes. Very recently, a couple of months ago, there had been a very big survey indicating that we are #1 globally in the mortality of women secondary to hypertension. Egypt is the highest all over the whole world. It's published in the very prestigious Journal of Heart. Just a few years ago, the second stepwise survey were done, and the results overall were the same. These are the highest countries in our region regarding the prevalence of or the mortality due to NCDs. And unfortunately, you can see that Egypt is right in the center among Lebanon and Tunisia, with a very huge number of deaths due to NCDs. We are, as a region, as Sandid explained to you just now, that we are exchanging the ranking between #1 and #2 among the 7 regions of the world. We and North America, we have almost the same population number, and we are exchanging the places of #1 and #2. This is an interesting table showing, this was shown by Dr. Sandid in his presentation. Egypt is #7, is #9. That was published in the Atlas of 2011. Just look at that. Egypt was #9 and expected to be #8 after 2 decades, with 7.3. This is according to the size of the diabetic population. It's not a prevalence, it's not an incidence. It's the number of people living with diabetes in countries. So Egypt was #9, and it was expected to be #8, and Pakistan would have appeared as #5, with, by that time, Pakistan was second to Egypt. But after 10 years in 2021, Pakistan people, under the leadership of Professor Abdul Basit, where's Abdul Basit? I can't see Abdul Basit here. In the first row. Abbasit led an excellent team from Pakistan. They revised, they did a national survey. And I remember I was awakened from sleep very early in the morning for Abbasit saying, we are announcing the results of our survey. which was a big surprise. The estimated number was 7.5 million, and they found it 33 million of diabetic people. Thanks to the effort of Abdul Basit, he pushed his country to this place, the third place in the whole world, to this miserable place. And thanks to him again, just he pushed Egypt down a little bit, so Egypt became number 10 and expected to be number 9 into decades. Most diabetes experts here in Egypt suggest that these figures are underestimation, and there has been a recent epidemiological study, not very recent. It was, almost 7 years ago, calculated the overall number of 11 million rather than 8 or 8.5 million. So there is a difference, not as big as Pakistan, but definitely a few years ago we had diabetes briefing book, which included systemic review of the literature, then expert opinions and analysis of the primary literature and analysis of the Ministry of Health, and the ultimate results which happened here, that we have 11 million rather than 8 million of diabetic individuals. That might be nearer to the reality rather than the original figure. What to do? We have to develop our national diabetes program. We are struggling, actually, I have to say, to develop a national diabetes program, but I can remember that once 3 or 4 years ago, we were on the verge. We were about to start to launch one, but at the last moment, it didn't happen. So we count on Akhtar, we count on the IDF just to revive our project of establishing and starting our national diabetes program. I think this is the right way to go, is to develop that. Professor Mursi Arab did a lot of work, and I mean, he had a lot of calls just to start that, but it has not been started yet. Well, diabetes prevention is right in the center. We have to focus, as Mohammed Sandid said, we have to focus on diabetes prevention. It's effective, it's cost effective, and it has to be adopted actually for every community. So in conclusion, ladies and gentlemen, diabetes should always be studied in the context of the NCD problem, because it's different to look at diabetes as an individual disease and among the other NCDs, because other NCDs will affect and be affected with the risk factors and the progress of different diseases. And the NCD problem currently forms a huge challenge in our country. Diabetes runs an epidemic course in Egypt, which negatively impacts health and economy and can have a potentially disastrous effect on our healthcare system if not urgently faced. However, establishing national diabetes program with focusing on diabetes prevention can help through cost-effective investment in healthy living and nutrition and health system development, can reduce the diabetes health and economic burden. Thank you very much.